Hi, Nancy Kelley here, and I am going to start a series of telling you about my experience with having a Medtronic back stimulator put in. I know that many people out there have heard about these stimulators and have questions and they're concerned and they want to know what other people have experienced in having these stimulators put in. And so I thought I would just give you a rundown on my experience. I had the surgery 2 days ago on Thursday. It's Saturday night. And when you do the procedure, at least for me, there were two incisions, one at the mid back and one at the lower. The mid back is where they place the leads or the paddles, and the lower incision is where they put the battery pack. Okay, and all of this is connected internally. The leads go up into your spinal column and are attached to about, mine are attached at about T8, thoracic 8. Um, and they go down and they ask me which side if I sleep on my side, which side would I sleep on? And I would sleep on my left side, so they put the battery pack kind of, well, it's mid back, but it's more toward the left. So, I mean, right. So I could sleep on my left side. Um, the surgery itself is not bad. Um, and I don't know if this is just a perk that I got from this surgery, but I was having some really bad neuropathy pains in my feet and especially my big toe. I had had surgery on that big toe and they just jacked it all up. So it was hurting all the time. It was angry and red, and you just couldn't hardly touch it. And since the surgery, that toe has not hurt. And the neuropathy pain in my feet, it's not there. Um, Now, I will say, it is very strange having an electrical current go through your body. But once you get it regulated, you really don't feel it. You'll feel just a gentle wave, and that in turn scrambles the pain waves to your brain. So your brain does not know it's hurting. I know, I know. Sounds strange, but you know what? I'll take it. Take it any day over the pain that I was having. Um, I did the trial for 7 days. Medtronic requires that. Excuse me, I'm gonna get some water. And Medtronic requires that you do a 7 day trial where they go in and put the leads in like through an epidural needle. The lead wires remain out. They tape it your back all up and then tape the battery pack down. And you wear this for 7 days, and it's kind of to see if it's going to work. Now, during the trial, my pain decreased by about 50%, which is fabulous. And so I was ready to go. I said, do not stop, do not pass go, don't collect $200. I would have, but they didn't offer it. So, anyway, I was ready for the surgery. Um, there comes a point, and you know what I'm talking about. Chronic pain that reaches a point when you are so desperate for some relief. And this gave me some hope. It brought my hope back. And so I was ready to go. Um, and so I had this done Thursday. And I just, if this continues as well as it is now, I'm going to be a happy, happy girl because my pain has decreased. And it does take some time in figuring out the stimulator and figuring out, you know, what your level needs to be at. I'm I'm gonna pause this just a second so I can get my little thing to show you. Okay, hang on tight. Okay, hi, back. This is the little device that I use, and I cut it on. Well, I cut it on. I do. I cut it on. See? Ah, you can't see everything, and it's not necessary. But I go in and I can unlock it, and if I'm having an exacerbation of pain, I can go in and, you know, get a jolt, so to speak. It's not bad. It sounds bad, but it's not. It's just a little electrical current, and it will. Then I kind of turn it down, um, or you can just hit the stimulation button, and it will give a gentle kind of rolling wave that will help take care of the pain also. The most important thing that you need to realize is you need to feel comfortable with your provider and the type of device that you're going to be getting. Now, I went with the Medtronic with the paddles. One, because this type of device, I can get an MRI done. And that was important to me. And two, from day one in the doctor's office, I met the representative from Medtronic. His name was Jake. And I cannot say enough nice things about Jake and Katrina. They're the two people that are my lifelines. If I have any questions, concerns, I've got their cell phone numbers. I call them and they're right on it. And they tell me exactly what to do. And that makes all the difference in the world, knowing that you have that backup. And so Medtronic, if you're listening, Jake and Katrina, awesome, awesome. So I just want to say I'm going to keep you updated. Like I said, this is day 2, and I'm an RN, and normally surgical patients, day 2 and day 3 are the worst. I've really done too much today. Been doing a lot around the house, so I'm really tired. But as far as pain, it has helped, and I'm going to be keeping you updated. And so if you would have any questions for me, please feel free to go on my Facebook page, or you can leave a comment here, and I'll be checking. But please, if you've been mulling around having this, but you're frightened, let me tell you who I used, what we did. Let me try to alleviate some of that for you, because I really am confident in my decision in doing this. It wasn't decided upon lightly, and I did a lot of research and with my doctor and with the hospital, and there's not one bad thing I can say about anybody that I came in contact with through his office, through the hospital, afterwards, the Medtronic people. So please contact me if you're looking to find out who I used, etc. So good luck to you, and I hope that what I'm going to be sharing with you will be helpful. Bye-bye. Have a nice night.